Hello, thanks for tuning into our Ask Me Anything session today. I'm Dr. Erik Sweet. I'm a comprehensive ophthalmologist with Baptist Eye Surgeons, and we're taking questions on diabetic retinopathy today. So the first question is, what is diabetic retinopathy? It's a good place to start. So diabetic retinopathy is damage to the retina, which is where the word retinopathy comes from, and it's damage that is due from diabetes or elevated blood sugar. The retina is the innermost layer of the eye. It can only be seen by looking through the pupil with a special lens, and it's a highly vascular tissue, meaning there's a lot of blood vessels there, which are damaged from high blood sugar. So what causes diabetic retinopathy? And essentially high blood sugar is the problem. High levels of sugar in the blood are frankly, they're just damaging to vessels, to your blood vessels, your arteries and your veins, especially the small ones, the capillaries. So the small blood vessels in the body are especially prone to this, and damage to these vessels causes leaking. It causes them not to bring blood supply to the organ that they're supplying, in this case the eye, as well as they normally would. This is the same problem that causes diabetics to have neuropathy, which is nerve damage, often seen in the feet. And as well as kidney disease. These are all vessel damage to the small vessels from diabetes. So are there different types of diabetic retinopathy? And the answer is yes. There's actually two main types or categories of diabetic retinopathy. The earliest form is called non-proliferative diabetic retinopathy. And this is associated with spots of blood across the retina. There's also different stages of this. There's three main stages of what we call NPDR. And this may also be associated with what's called macular edema, which is swelling in the macula being kind of the central and almost most important part of the retina, where your central vision is handled. In addition, there can be something called macular ischemia being kind of a lack of blood supply or damage due to low blood flow to the area. And those can be associated with this non-proliferative diabetic retinopathy. And what's considered kind of the more severe form of diabetic retinopathy is called proliferative diabetic retinopathy. And what distinguishes the two is the presence of abnormal blood vessels. So in the proliferative form, the tissues of the eye are starved for oxygen, and they send out signals to ask for help. And in response, the body grows abnormal blood vessels. But unfortunately, rather than helping, those vessels can lead to significant problems. These problems may be retinal detachments or severe kind of pooling of blood inside the gel of the eye. Or sudden onset of glaucoma leading to permanent vision loss. And the complications of this can be quite profound and even irreversible. The next question is, how can diabetic retinopathy affect the vision? This goes back to the different stages of diabetic retinopathy. So whether there's vision changes or what those vision changes are depend on the stage. Early diabetic retinopathy often doesn't have any symptoms, so even mild to moderate and even severe forms can be detected and seen when a patient really has no vision complaints. In some cases, the vision complaints are vague. People say, my vision's blurry, I don't see as well as I used to, my glasses aren't working well anymore. Other times they're more specific. You can have certain spots in the vision. As I mentioned before, you can have sudden vision loss from a glaucoma or a glaucoma process, or from a really bad bleed inside the eye. But it's part of the importance of getting an annual dilated eye exam with an ophthalmologist, because a lot of times there aren't symptoms until there are profound symptoms. Someone asks, is diabetic retinopathy the same as macular degeneration? The answer is no. Both of these diseases affect the retina. Macular degeneration affecting the macula, and it's a degeneration of the macula. As I mentioned before, diabetes can be seen as damage to the macula, but it's different. Macular degeneration often refers to age-related macular degeneration. Risk factors for that include aging, genetics, and environmental exposures, and not diabetes. So macular degeneration is seen in both diabetics and non-diabetics. And somebody can actually have a diabetic retinopathy and a macular degeneration, but they are not the same thing. They can be together, they can be separate. They're different processes and have different risk factors. So, what is the first sign of diabetic retinopathy? So I see this all the time. I saw it today, seeing patients in the morning, and the first sign would be small spots of blood inside of the retina. They can actually be difficult to see, so you want a competent, ophthalmologist evaluating you, but just little spots of blood that are well under even a millimeter in size that are seen in the back of the eye. And that's the warning sign that the diabetes is starting to affect the vision. Someone wants to know, can diabetic retinopathy be cured? In many cases, the diabetic retinopathy, damage to the eyes, can be reversed or halted, but it's not generally cured. Once the process starts, once the diabetes is bad enough and damaging enough that it hits the eyes, it's rarely cured. There are certain circumstances where somebody has really poorly and uncontrolled diabetes for long periods of time that are left undetected. And then it's brought under aggressive control, and after that, the diabetic changes go away and they're never seen again. So you could maybe call that a cure, but for the most part, it's not cured, but it can be certainly slowed down and sometimes partially reversed. So on that note, somebody says, can diabetic retinopathy be prevented? And the answer is yeah. In most cases, it can be. What contributes to having these diabetic changes in the eye is poor blood sugar control. Elevated blood pressure will also contribute and worsen the diabetic changes, and then having diabetes for a long period of time. So people can't change how long they have diabetes. The younger you're diagnosed, the longer you will have it, but people can certainly control their levels of blood sugar to different levels of success. So if you're diagnosed with diabetes and you control your blood sugar very well for long periods of time, you never let it get out of control, you see weight loss and significant diet changes, you take your medication as you're needed and as instructed, a lot of these patients will never see diabetic retinopathy. And if they do, it's often very mild to the point where it's not going to affect their vision or have major problems. It's usually the uncontrolled, the poorly controlled blood sugars that lead to the damaging forms of retinopathy. Someone wants to know, how quickly can diabetic retinopathy progress? And again, this really depends on the blood sugar control. So the better the blood sugar is controlled, the slower it's going to progress. Sometimes we have patients who come in and we discover a mild retinopathy that's going on, and we kind of encourage them to control their blood sugar. Maybe their blood sugar is running in the 200s frequently. Maybe their A1C level is 9 or 10. And if they let their blood sugars continue that way, things can progress quickly. They can see vision changes in less than a year. But if the A1C level and the blood sugars are well controlled, then things can really slow down. And as I mentioned before, they can even reverse. Those with undetected or really severe diabetes that's being ignored, not treated, they can go from 20/20 vision to being blind in an eye in less than a year. We don't like to see that. I see it every few months, and it's unfortunate. So in some circumstances, it can be very rapidly progressing. So what is the treatment for diabetic retinopathy? Again, this depends on the severity of retinopathy. First of all, it includes aggressive blood sugar control. It involves working with your primary care doctor, possibly getting on insulin, new oral medications to really get the blood sugar under control. That being said, sometimes there's damage to the eye, or the blood sugar's been under control, but it's damage from a history of being poorly controlled, and we need to do something. Treatments may involve a laser surgery, which puts laser spots on the retina. Some circumstances involve injections of particular medication into the eye itself, where it can be most effective in controlling the symptoms. Other times it involves a retina surgery, particularly a surgeon may need to go into the eye and take out the gel of the eye, or in the case of like a retinal detachment, flatten the retina and help the retina reattach. Hopefully you don't get to those cases, and it can be controlled with medication, diet, exercise, weight loss. Patient asks, what A1C level causes diabetic retinopathy? So the A1C level, first of all, it's a good number to know if you have diabetes. This is a number that you should track over time. You should be aware of, hopefully have your most recent hemoglobin A1C, it's called, when you come to see us, so we can have an idea of how well your diabetes is controlled. That A1C level is kind of, it's a way of looking at the average blood sugar control for the last few months. It does change over time. But it gives us an idea of how the blood sugar is doing, not just one blood sugar measurement, but on average over a period of time. And there's no magic number. There isn't one number that causes diabetic problems in the eyes, or even any diabetic problem. It's the higher the number is, the quicker and more commonly you will see problems. So an A1C level, generally over 6.5 is considered diabetic. If you control it where it's under 6.5, it is uncommon to see diabetic problems in the eyes, especially if it's always been well controlled. Still, after 30 years, 25, 30 years, even those under good control, an A1C level of 6.5 or under, can start to see some mild changes. Alternatively, someone with an A1C level of 14, 15, we've seen before, or higher, can have significant damage to the retina and have that quickly. So the better the A1C, the better the eyes do. So for kids with diagnosed with diabetes, are there any tips to prevent vision problems from developing? And absolutely. And really this comes down to controlling the diabetes. For type 2 diabetes in children, which is becoming more common, this often requires aggressive lifestyle changes. It can require significant weight loss, dietary changes, and kind of a reprogramming of how that child eats and functions in some ways. So it may require insulin or medication for that child as well. But controlling the diabetic blood sugars will definitely have a profound impact on that child's life, not only for their eyes, but for their other diabetic consequences as well. Same goes for a type 1 diabetic. A type 1 diabetic needs to control the blood sugars. And that is often done through insulin pumps. Continuous glucose monitoring are both things that really help bring the diabetes under control. And that's what it comes down to for these kids, is that the diabetes is under control. Helping the kids take responsibility for their own diabetes is important. And having them understand the consequences of long-term poor control can be important to encourage them to take control of their diabetes and monitor it and treat it on their own, especially as they age into teenage years and beyond. For the kids with diabetes, annual eye exams are imperative to look for and evaluate it for diabetic eye disease. But with good blood sugar control, they can do well over time. With poor blood sugar control, they can start to have major issues, even in 20s, 30s, and sometimes sooner. Um, Somebody asked, what other concerns should diabetics have about their eyes? So diabetic retinopathy is not the only way that diabetes hits the eyes. Something that I see relatively frequently is those, especially new diabetics, when the blood sugars get out of control into the level of the 300s. People can have swelling of the lens of their eye, and that can lead to sudden shifts in a glasses need. So how patients present is maybe they wear glasses and suddenly their glasses don't work. Maybe they see better without the glasses, or the glasses aren't strong enough, and this is generally a pretty sudden change over days, but it can last for weeks or longer. Or there's patients who don't wear glasses who find that suddenly everything's blurry. They can't read road signs that they were able to read before. They can't read books, and it can be scary because you get a quick vision change where things gets very blurry. Monitoring and evaluating your blood glucose, certainly keeping it under 300s, will help prevent that. Other issues that they can have, diabetics tend to get cataracts at a younger age. It's not uncommon for somebody with severe uncontrolled diabetes to have a cataract that needs surgery even in their 40s or young 50s. It's more uncommon for cataracts to develop that young in somebody who does not have diabetes, but that's certainly a problem that can be seen in diabetics. In addition, diabetes can damage the nerves to the eye, just like it can damage nerves anywhere in the body. Feet is a major issue, diabetic neuropathy. The diabetes can hit the nerves that control the movement of the eye. And then suddenly a patient will have an eye that's not moving well. Now, they may not notice that, but what they will notice is that they have double vision. Instead of seeing one clear image, they see two images that are side by side or up and down from each other, and that's constant. It doesn't go away. That is something that brings a diabetic in regularly, and it should, because that can be there are actually life-threatening problems that can cause that same symptom. Often with diabetes, that damage to the nerve will reverse, but sometimes it can be permanent as well. So overall, it's important for diabetics to control their blood sugar, to have an annual diabetic dilated exam, again with a competent ophthalmologist. We're glad to see diabetics. It's a large part of what we do, and they're welcome to make an appointment and come in with any concerns. Thank you for joining us today. I hope we answered your questions about diabetic retinopathy. We'll continue to do these sessions in the future. So if you have any questions, continue to follow us on Facebook and social media. Post your questions. We'll often put questions out, or a chance to send in questions before we do videos. So feel free to contact us at any time. If you have any concerns about your own eyes, you have any major changes with the vision or your eyes, you give us a call and can make an appointment. Thanks for joining today. Have a blessed one.